Hello and welcome to our health education video series presented by the nonprofit organization Help Me Help You. Today we are going to talk about high blood pressure, which is also known as hypertension. Our theme, Food is Health. This is our fourth video series, and we will talk about what we can eat to help prevent and manage high blood pressure, benefiting the whole family. What is high blood pressure? High blood pressure means the force of blood pushing against your artery walls is consistently too high, making your heart work harder to pump blood. It is often called a silent killer because it usually has no symptoms but can lead to heart disease, stroke, kidney problems, and vision loss. Blood pressure is measured in millimeters of mercury, mmHg. Normal is less than 120/80 mmHg, and high blood pressure is 130/80 mmHg or higher. How does someone get high blood pressure? The risk factors include the following: age. Risk increases as you get older. Family history. Genetics can play a role. Being overweight or obese. Eating too much salt or sodium. Not getting enough physical activity. Smoking or using tobacco. Drinking too much alcohol. Chronic stress. And certain health conditions like kidney disease and diabetes. Ethnicity also plays a part. Black Americans are more likely to develop high blood pressure, often at a younger age, and may experience more severe cases. Social factors like access to healthy food, healthcare, and experiences of discrimination can increase risk. Some medications may work differently in different ethnic groups, so personalized care is important. Hispanic and Asian communities may also face unique challenges, such as language barriers or traditional diets high in sodium. What can you do if you have high blood pressure? Lifestyle changes. You can eat a heart-healthy diet. You can also get regular exercise. Aim for at least 150 minutes of moderate activity each week. You can also maintain a healthy weight. You can limit your alcohol use and quit smoking. It's also important that you get enough sleep. 7 to 9 hours is great for adults. You can also manage your stress with relaxation techniques like deep breathing or mindfulness. And then there's medication. Sometimes medicine is necessary. Always take as prescribed and keep regular checkups with your doctor. Eating right to prevent or manage high blood pressure. Have you heard of the DASH diet? DASH stands for Dietary Approaches to Stop Hypertension. This is proven to lower blood pressure. The DASH diet focuses on fruits and vegetables, 4 to 5 servings per day, eating whole grains, 6 to 8 servings per day, low fat or fat-free dairy, 2 to 3 servings per day, lean proteins like fish, poultry, beans, nuts, 4 to 5 servings per week for beans and nuts. It also includes healthy fats like olive oil or nuts, and limiting your sodium to 2,300 mg per day or less. 1,500 mg per day will provide greater benefits. Key nutrients in food. Potassium. Potassium, like bananas, sweet potatoes, spinach, avocados, or oranges, can help with high blood pressure. Magnesium. This includes leafy greens, nuts, seeds, whole grains, and beans. Calcium includes low-fat dairy and leafy greens. Fiber. This includes whole grains, fruits, vegetables, and beans. Omega-3s. This includes fatty fish like salmon, mackerel, and it includes walnuts or flax seeds. Nitrates. This includes beets, leafy greens, and berries. What foods should you avoid? Avoid processed meats like hot dogs and sausages. Avoid salty snacks like chips and pretzels. Avoid canned soups and vegetables, which tend to be high in sodium. Also, avoid fast foods and fried foods, also high in sodium. You also want to avoid full-fat dairy items and sugary drinks and desserts. This means no more sodas or limiting your sodas. Culturally specific tips and recipes. For African American families, incorporating more fruits, vegetables, and low-fat dairy are key components of the DASH diet. This can help manage your blood pressure. Traditional dishes can be modified to use less salt and more herbs and spices for flavor. For example, collard greens can be cooked with smoked turkey instead of ham hocks, and oven-based chicken can replace fried chicken. Increasing the intake of potassium-rich foods such as sweet potatoes, beans, and leafy greens is particularly beneficial. Traditional dishes can be made heart healthy. Use smoked turkey instead of ham hocks and greens, and you can also use herbs as your seasoning instead of salt. Try oven-baked chicken instead of fried chicken, and use brown rice or quinoa for sides. For Latin or Hispanic families, traditional Latino dishes can be adapted by emphasizing beans, avocados, tomatoes, and corn, all of which are heart healthy and low in sodium. Using fresh herbs, lime, and spices instead of salt for seasoning is encouraged. Popular dishes like black bean salad, ceviche with plenty of vegetables, and grilled corn can be prepared in a way that supports healthy blood pressure. Use more fresh herbs like lime and spices for flavor instead of salt. Choose beans, avocados, tomatoes, and corn as staples, great for blood pressure. Also, try an avocado, tomato, and corn chickpea salad for a healthy meal. For Filipino and Asian families, a culturally tailored heart-healthy, low-sodium cookbook for Filipino Americans included traditional recipes adapted to reduce sodium while maintaining familiar flavors. Examples include fish sauce or soy sauce in moderation, and boosting flavor with garlic, ginger, and vinegar instead of salt. Dishes like pinkabet or vegetable stew, sinigang or sour soup with lots of vegetables, and grilled fish can be prepared with less salt and more fresh vegetables, aligning with blood pressure management goals. Reduce soy sauce and use low-sodium versions. Add more steamed vegetables and tofu. Use brown rice or whole grains instead of white rice. And now, here are a few family-friendly dash recipes. First, we have the healthy porridge bowl. This includes oats, berries, bananas, seeds, and low-fat milk. Great breakfast idea. Second, we have sweet potato and spinach bowl. This includes roasted sweet potatoes, sauteed spinach with black beans, and a sprinkle. For the third item, we have a green smoothie. This includes spinach, pineapple, banana, and fourth, we have chicken with crushed chickpeas. This includes grilled chicken breasts with a chickpea, tomato, and parsley salad. Here is a summary table expressing hypertension prevalence overall. Black Americans 55%, highest overall, earliest onset. Hispanic Americans 33%, Dominicans 39.4%, and Puerto Ricans. Asian Americans 38%. This includes South Asians, Filipinos 43 and 60%. Non-white Hispanic, other major groups. Let's make it interactive. Here are a few family activities you can have with your family members. Cook together. Let your children help wash vegetables or stir ingredients. Try a new recipe as a family every week. Take the grocery store challenge. Make it a game of finding low-sodium foods or new fruits and vegetables. Family movement. Get together and dance. Go for a walk or play outside together for at least 30 minutes a day. Track your progress. Use a family health journal to log meals, activities, and blood pressure checks. And finally, role play. Practice ordering healthy meals at restaurants or reading nutrition labels together. In conclusion, high blood pressure can affect anyone, but healthy habits make a big difference. Eating well, staying active, and supporting each other as a family helps everyone's heart. Remember, food is health. Every meal is a challenge yourself. Challenge yourself and your family to try one new heart-healthy recipe this week. Experience in the comments. You can also leave a comment below and let us know what you tried this week. This can help encourage others. And now we have a few resources. Please view the following pages. As always, thank you for joining us. We hope to see